Have you ever felt like you can't breathe? Your heart is about to pound out of your chest. Your head is swelling with air. The world around you is spinning, but everything is in slow motion. Anxiety attacks are scary. Anxiety attack is the sudden onset of intense anxiety, characterized by feelings of intense fear and apprehension, and accompanied by palpitations, shortness of breath, sweating, and trembling. Many people experience anxiety attacks, and many people have also found them to be preventable. Also, anybody can have anxiety. Statistics say 40 million adults aged 18 and older in the US suffer from anxiety. Only 36.9% of the adults with anxiety can also get treatment. As stated in WebMD, it is also important to note anxiety can affect you mentally and physically. There are several ways anxiety can affect you mentally. Having anxiety can affect your relationship with your loved ones, your sleep schedule, healthy eating habits, and anything of your overall daily schedule. Just all above your overall mental health. There are also several ways anxiety can affect you physically. When having an anxiety attack, or how you know when you're getting ready to have an anxiety attack, your heart rate and breathing increases, concentrating blood flow to the brain, according to healthline.com. There are also ways to prevent an anxiety attack. Just a few are you can do and practice breathing exercises, practice mindfulness, use muscle relaxation techniques, and of course, also take medication. There are many different types to treat this, as there are different types and different severities of anxiety, which depends on which medications or which treatment you seek to use. As stated by verywellmind.com, the lack of diagnostic recognition of anxiety attacks means that the signs and symptoms are open to interpretation, said by Medical News Today. An anxiety attack usually involves a fear of some specific occurrence or problem that could happen. Symptoms can also include worry, restlessness, and possible and more extreme physical symptoms can cause your heart rate to increase or lower and could eventually, if not careful, lead to a heart attack. It is also important to know that anxiety attacks are different from panic attacks, but it can also occur as part of an anxiety or panic disorder. Commented from Mayo Clinic. Experience of occasional anxiety is a normal part of your life. However, humans with anxiety disorders frequently have intense, excessive, and persistent worry and fear about situations happening in your everyday life. Often, anxiety disorders involve repeated episodes of sudden feelings and intense anxiety and fear or terror that reach a peak within minutes, also known as panic attacks. Those feelings of anxiety and panic interfere with activities on the daily, and they are difficult to control, are out of proportion to the actual danger, and can last a long time. It helps to avoid certain places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, specific phobias, and separation anxiety disorder. You can have more than one anxiety disorder at a time. Sometimes anxiety results from a medical condition that needs treatment. Here are a few definitions of types of anxiety from the Mayo Clinic as well. Agoraphobia is a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Anxiety disorder due to a medical condition includes symptoms of intense anxiety or panic that are directly caused by physical health problems. Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events. Even ordinary routine issues. The worry is out of proportion to the actual circumstance. It's difficult to control and affects how you feel physically. It often occurs along with other anxiety disorders or depression. Panic disorder involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart, also known as heart palpitations. These panic attacks may lead to worrying about them happening again or avoiding situations such as school, and when they can speak in other situations such as at home and close family members. This can interfere with school, work, and social functioning. Separation anxiety disorder is a childhood disorder characterized by anxiety that is excessive for the child's development level and related to separation from parents or others who have characterized and have parental roles. Social anxiety disorder, also known as social phobia, involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Specific phobias are characterized by major anxiety when you're exposed to a specific object or situation, and a desire to avoid the situation. Phobias provoke panic attacks in some people. Substance-induced anxiety disorder is characterized by symptoms of intense anxiety or a panic that are directed as a result of misusing drugs, taking medications, or being exposed to a toxic substance or withdrawal from drugs. Other specified anxiety disorder and unspecified anxiety disorder are terms of anxiety or phobias that don't meet the exact criteria for any other anxiety disorders, but are significant enough to be distressing and disruptive. Here are the statistics of anxiety and which can lead to depression. Anxiety is a major problem in today's world, and it is leading to attacks all over every single day. There are ways to prevent them, and they can affect your physical and mental overall health. Anxiety needs to be addressed.